Our first couple of modules, these first 2 weeks, we need to look at some information that's related to health promotion and disease prevention. And there is quite a variance in the next couple of weeks, but this will set the stage for us as we go through diseases and disorders of the systems. So let's start with population-based care for the primary care provider. Our author of the text says that population management can be used to improve practice in primary care. And they define this a little later on through the chronic care model and the primary care medical home. But let's just talk about, for a moment, the current challenges and what they mean to us as nurse practitioners. So there's no doubt that there are not enough young physicians going into primary care. Most are choosing to go into a specialty care. And the older physicians that are in primary care are getting out of primary care. However, at the same time, there's this mounting pressure to increase access to care and improve patient outcomes while you're enhancing patient satisfaction and reduce cost of medical care. So you can see this as quite a mismatch. Policy experts and our politicians have called for a radical transformation in primary care, and the way they propose this to happen is through a chronic care model and through a primary care medical home. And they feel like this would transform access to care and improve outcomes because there would be interdisciplinary management of the patient. And that in turn would enhance satisfaction and reduce cost. However, we don't have enough evidence behind that yet to see if that's transformative. What we do have evidence behind is a very important part of this proposal is for nurse practitioners to become primary care providers and practice leaders. And the evidence already says that we have the same or better exceed physician outcomes in management of disease, and we can do that at a reduced cost. But although I know they make a statement in our textbook that there are some medical associations that have called for projects of NPs to lead primary care medical homes, I don't know if this has been accepted. I actually don't believe it has at this point in time, but maybe you can find some literature that proves me wrong. That would make me very happy, because I do think we're part of the solution. I just think there's a lot of political brouhaha that disallows this from happening. So third, or finally, just keep in mind that the overall goal of primary care transformation is the creation of an environment that puts patients at the center of care while improving quality and efficiency. And I think none of us would argue that is a excellent overall goal. Let's look briefly at routine health screenings and what the implications are for achieving high quality primary care for our patients. We know that health screenings and immunizations, along with health risk assessments and education about a healthy lifestyle, form the cornerstone of primary prevention and health promotion activities in primary care. And that's what NPs are experts at. And knowing where these health screenings and health risk assessment tools are located and implementing them into your practice is really important. I did include in your notes, review the level of prevention, what those levels are and how they apply to our patients. So which health screenings are considered routine? It really varies between organizations or agencies making the recommendations, and there are multiple guidelines and recommendations available for us to use as advanced practice nurses. I do think that it's important for us to look at the U.S. Department of Health and Human Services guidelines and what they recommend for all adults age categories. And basically saying that patients should have a full health evaluation that includes height and weight, skin exam, appropriate evaluation of heart health, bone health, diabetes, breast health, reproductive health, colon and rectal health, eye and ear health, and oral health. I'm going to direct you to page 146 in your text, starting with table 17.1. So the U.S. Department of Health and Human Service guidelines are pretty straightforward. They are divided in age category, but we also need to look at the last group, the U.S. Preventive Service Task Force recommendation, or task force, and realize that's a panel of non-governmental health providers, primary care and mental health, considered to be experts in health promotion and disease prevention and evaluation of health-related research. Now, what you've got to what I'd like to reiterate is that guidelines differ according to whatever research they're looking at and basing their judgment. For instance, let me just give you an example. The U.S. Preventative Services Task Force does not either recommend a skin exam for adults looking for skin cancer. However, that's in quite conflict with American Cancer Society and the American Dermatological Society. And you can read why, but you have to be very cognizant of what are the guidelines and the organizations that present them, and which ones are you going to use. It really is ultimately, as long as you're using an evidence-based guideline, it's up to you which one you think is the most appropriate. So there's multiple tools to assess an individual's lifetime risk for certain diseases, such as heart disease and breast cancer. These are used as an adjunct to making health screening decisions and indicating whether a patient is at high, medium, or low risk for the condition. That's all part of clinical reasoning. So I have given you an example, some tools for health risk assessment. And again, when you are coming up with differential diagnoses, when you're seeing a patient, you have to look and consider the health risk. That's a piece of information that will help you determine the most appropriate diagnoses for the patient's problem. I am going to ask you to look at the cancer screening health risk assessments, particularly because cancer is the second overall cause of death in the United States, accounting for 1 out of 4 deaths. So if you could look at those tables, 17.4 on page 153 and 154, it directs you to what we're looking at: breast, colon, and rectum in men and women, cervical women, prostate for men, endometrium women, and cancer-related checkups for men and women. The next several slides look at immunizations, and I'm not going to read those slides to you. You have to know what immunizations are required for the population you're treating, or are available, required and available, and which ones are appropriate. That not only leads to wellness and disease prevention, but it's just part of our responsibilities to know the standards of adult immunizations in practice, and really making decisions about the safe administration of vaccines for our patient. In just a few minutes, I'm going to talk about travel health. So there are some additional vaccines on this page listed that have to do with our patients that travel and what are our responsibilities. And I take this very seriously, and you will be tested in your certification on adult and childhood immunizations, and they'll give you scenarios, and you'll have to pick what the patient needs or what would lead you to make one clinical decision over another. I have included some contraindications to vaccine. Just review this. I also want you to be aware of specific precautions for vaccines, so you need to review that. But are you aware that our government has a organization or a section or sector that is available when people are injured by vaccines? And I'll give you that information in a news tool. I use CDC for both my immunization reference and for my travel health. And there are other resources, but it's reliable, it's updated. And so I just gave you the link right here, and you can just confirm if there's been any changes. I looked, put a couple of changes, and I will thoroughly look and introduce any changes that might have happened in the last, say, 6 months. So let's talk briefly about college health. It happens to be my area of practice. I've been in ETSU, University Health Services, now for 9 years, and I find it very challenging and very interesting. And let's just tease out the implications for a nurse practitioner working as a primary care provider in a university setting. These statistics are old, so there's over 20 million college students in the U.S. Our textbook gave us that, and I would say it's probably increased. The mission of college health services is to promote well-being and by offering health education and illness prevention programs, and ultimately contribute to the academic success of the college student. And I am particularly challenged by the role of a college primary care provider, since I am one. And I think I have the ideal opportunity to affect a young adult at a critical time of development. Now, I know that college students are diverse now, but the majority that use our services are living on campus or close to campus and are young adults. So topics that come up frequently in college health, specifically for female and males, are reproductive, substance, safety, eating disorders, and weight management, LGBTQ, and we will cover that at a later time in the semester, but they have some unique health problems and more challenges on a college campus. Certainly mental health issues. At ETSU and University Health, we have what we call integrated primary care, which we have mental health services along with primary care and are able to do warm handoffs if needed. Sleep issues, screenings and immunization, and certainly cultural issues because of the diverse student population. And that really expands you as a primary care provider. Often, this is the first time that these college students are seeing a provider by themselves without a parent or a guardian. And so it really is an opportune time not only to take care of whatever is the focused exam of the day, but also integrate health promotion and disease prevention. At the same time, as we're just briefly reviewing travel health, many of our students are traveling abroad during a semester. But in primary care, outside of college health, there are a lot of your patients that will come to you for travel health advice and care. They need pre-immunizations and they may need medication. So CDC is very specific in saying we must know the areas they're going to travel for appropriate recommendations, and they have a comprehensive education and care information for us as primary care providers. And they also divide it into the traveler themselves so that they can be well prepared past just what the healthcare needs are. In 2014, there were 1.1 billion travelers. Across the world, there were about 1,300 Americans who died while they were traveling. Most of them died from cardiac or chronic disease, but some had accidents. The information is brief and to the point, concise in our textbook. It also, on page 174, gives you some information about how we can become educated further in travel medicine. Please refer to these sites for more information.